So I'll introduce myself. I'm Sabrina Weaver. I'm the Executive Director of Human Resources for Marshall Medical Centers. And I wanted to thank you all for letting us come and meet you today and talk a little bit about Marshall Medical Centers and what we like about working here and why we think this is a great place to work. So I'm going to share my screen now. And while I'm doing that, I would like to tell you that a little bit about myself. I have an undergraduate degree from the University of Alabama, and I have a master's degree in healthcare management from Vanderbilt University. And I'll put this in full screen slide. And so, of course, we think Marshall Medical Center is a great place to work. We think it's the best place to work, but there are a lot of great places out there. So our mission is to provide high quality care and services that will improve the health of those we serve. And if you're not familiar with where we're located, we are located in Alabama's Mountain Lakes region. It is a gorgeous place to live and work, and a lot of attractions if you like to enjoy the lake, or if you like to hike or zip line or do a number of outdoor activities. It's a great place to be. We are partners with Huntsville Hospital Health System. We're an affiliate hospital, and you can see from the map that there are several hospitals across North Alabama and Southern Tennessee that are affiliates of Huntsville Hospital. And this is, of course, an advantage to employees because it allows you to transfer. You may begin your career with us, but then you may decide you'd like to move to the other side of the state, and we can help you transition to, say, Helen Keller, and then you would retain your original date of hire for that longevity. We are a publicly owned, not-for-profit, two-hospital health system serving Marshall County. We're well-equipped acute care facilities, and we offer comprehensive services. Marshall Medical Center North is a 90-bed facility, and we have 589 employees that work at that location. That's in Guntersville. And then Marshall Medical South is located in Boaz, and we have 975 employees that work there and 150 beds at that location. Marshall Cancer Care Center is located mid-campus, close to Albertville, and it is on that campus along with the Professional Center, which has a healing center, sleep disorder center, imaging center, rheumatology, and vascular and vein specialists there. We also do have an inpatient psychiatric facility at Marshall Medical Center North, as well as an affiliation with Medical Centers Home Care. We offer an excellent benefit package and retirement plan, including retirement match and many other standard benefits that employees are eligible for. And again, if you'd like to know more information about our careers, we encourage you to visit mmcenters.com.
I'm Cheryl Curran. I do ultrasound. I do general, vascular, OBs, and echoes. I've been employed for 21 years here, and this is my first job and only job. I've stayed here since I was a student. And we have some Wallace students, and we have hired them PRN to start out as a student, and some of them have become employees.
I'm Miranda. I work in the X-ray department, and I also work in the cath lab. I go over to the OR, and I've been trained in some CT. There are a lot of opportunities here when you're an X-ray tech to venture into other fields. And I got hired here as a student tech in the beginning after I did clinic here for 2 years. And then I transferred to Huntsville Hospital for about 4 years, but I just recently came back because this is like my home, and I love being around all these people that I work with. So you just get a lot of experience being here and being encouraged by all of your coworkers. So it's a really good environment for students.
We're small, kind of family oriented, all close. And so usually our students come and they apply and want to stay.
Yeah.
So.
Hello, I'm Amy Jennings. I'm the Director of Inpatient on the Marshall Medical Center North Campus. I started my career or my education at Wallace, got my associate's degree, then I got my bachelor's at Jacksonville State, and I got my master's at UAH in nursing leadership. I have been at Marshall North for 21 years. I started as a new graduate in the ICU as a staff nurse. Marshall North is a great place to work, of course, or I wouldn't have been there for 21 years. I have lots of room for professional growth. I have been a staff nurse, a clinical supervisor, a charge nurse, a nurse manager, and now I'm a director. And every one of those has been very fulfilling for my career. And I also get to still put my hands on patients every day that I'm there. I get to talk to patients as well as staff, and I can still do as far as anywhere from a bed bath all the way up to critical care skills, and then still doing my management skills as well. So you still get all of that variety. So it's a very good place to be able to do all that. I'm going to introduce you to Megan Neesmith, Scott Neesmith. She is my counterpart at the South Campus. She's the director of inpatient there.
Hi, like Tammy said, I'm the director of inpatient at Marshall South. I've been here 11 years. And like Tammy, I've had many different roles while I've been here. I received an associate's degree from Snead State Community College. I then went on to receive my bachelor's from the University of Alabama. I then received a master's from the University of South Alabama. I've worked as an acute care nurse at the bedside. I was also cross-trained to do ICU and ED. That's another reason why I love starting my career here. I got a lot of experience in a lot of different departments. I then became a clinical house supervisor, a nurse manager, and now work as a director.
I'm going to talk to you a little bit about the positions that we have available here between both campuses. These are the inpatient positions that we have on acute care, which is our med-surg units. We have ICU positions. We have OB positions on both campuses. We also have our psych unit on the behavioral health unit on the North Campus. We have some PRN positions there as well. Those are all listed on the Marshall Medical Center's website at mmcenters.com, which Sabrina has already mentioned one time. I don't want to bore everybody with listing all what we do have, but there is a number of opportunities out there and a wide range of opportunities for whatever you're interested in. We also have different compensation for different positions. So it's just kind of according to what you're looking for. We have a fit for anything that anybody's really looking for. We have positions that are mainly during the week with just a few weekends. We have weekend team positions that have compensation for that. We have PRN positions that have various levels. We have 4 different levels of PRN positions. And according to what you want to work doing that, there's 4 different levels of pay compensation for that. It goes all the way from just working 2 weeks or 2 days every month with 1 holiday, all the way up to working 3 weekends per month with the holiday rotation in with that. And of course, that's a lot more compensation than the lower would be. So we like to think of it as you fit what your needs are and what your family's needs are, and then we'll fix the schedule around that. So that's kind of the positions that we have. We do this, we have policies that are the same at both campuses. We have processes that are the same at both campuses. That allows us to be able to staff both campuses and for you to be able to float between both campuses as well. And you feel like you're more comfortable and know what's going on. Megan's going to talk to you a little bit about our orientation process and what that looks like.
One thing we often hear from new graduates and nurses in general is that we have a great orientation here at Marshall Medical Centers. Our orientation, we strive for a goal of 6 to 8 weeks in orientation, but we realize that everyone learns at a different pace, and this can be adjusted to fit your needs and individualized. We want to put safety first. So we want you to be safe. We want you to practice safe. We want our patients to be taken care of. So that's very important to us. We touch base with our new nursing graduates multiple times during orientation. And we have a sit down conversation with them with a tool that we want to make sure that you have everything that you need. You're getting the appropriate feedback and answer any questions that you may have. One thing that we often hear when we sit down with our new graduates during this time is that the staff is very helpful. This is just kind of our culture here at Marshall Medical Centers. They said that people are friendly and that we are very teamwork oriented. We often hear, everyone is so kind, feel like family. So that is something very important to us, that we sit down and monitor our new nursing graduates during their orientation.